You probably think you'd know if you had cancer. A lump you can feel, blood where it shouldn't be, weight falling off for no reason. Here's what terrifies me as a doctor. By the time you notice those things, you're not early. You're late, and sometimes the kind of late that changes everything. I'm Dr. Sam Brown, and what I'm about to share with you are the signs of cancer that appear before you feel sick, the ones that show up when you can still do something about it. Let's start with something you see every single day: your skin. Skin cancer and melanoma are shockingly common, and the biggest trigger is ultraviolet radiation. So if you're someone who bakes in the sun until you're the color of roasted coffee, listen up. This matters. Here's where people mess up. You check your arms, legs, face, the obvious spots. But melanoma doesn't play fair. I've found it on the sole of a foot, hiding under a toenail, tucked into places people never think to look. It doesn't wait for permission. So what should you actually watch for? First, look at the borders of your moles. Healthy moles have sharp, clean edges. Dangerous ones? Blurry, smudged, like someone dragged their thumb through wet ink. Second, color. A normal mole is one consistent shade. A suspicious one has patchy pigmentation, lighter here, darker there, uneven throughout. And if you had one small mole that's now become a cluster of 3, that's your body waving a red flag. Here's the part that surprises people. Even a mole you were born with can turn deadly if you keep hammering it with UV exposure. Chronic sun damage rewrites your DNA, even in tissue that's been there since day one. That's not bad luck, that's biology. If you've got a lot of moles, see a dermatologist once a year, not just for a quick look, but for dermoscopy. That's where we photograph your skin and compare it year after year, so we're not guessing, we're tracking. And here's a sobering fact. The countries with the lowest skin cancer rates, they're either cloudy year-round or have cultures where people cover their skin. That is not a coincidence. Now let's talk about breast cancer. This affects nearly every woman at some level of risk, and the symptoms most people recognize are already late stage. A lump. Discharge from the nipple. Dimpling that looks like orange peel. Swollen lymph nodes tucked under your arm. If you've got orange peel texture, the cancer has already invaded surrounding tissue. If lymph nodes are swollen, it's likely spreading. These are not early warnings. They're alarm bells that have been ringing for a while. The earliest sign? A tiny, firm lump, about the size of a pea. And here's the brutal truth. Anything smaller than that, your fingers won't catch it. So if you're waiting until you can feel something, you've already lost precious time. That's why I push hard for annual ultrasounds and mammograms. It's the only way to catch breast cancer when it's actually small enough to stop in its tracks. Now let's shift to the cancers lurking inside your body, the ones you can't see or touch. Lung cancer is one of the deadliest, and it has one screaming association: smoking. Yes, I know. Someone's uncle smoked 2 packs a day and lived to 90. I don't care about outliers. The statistics are merciless. Smoking equals lung cancer. If you smoke, your odds of developing it by the end of your life skyrocket compared to someone who never touched a cigarette. But here's the kicker. Lung cancer can also hit non-smokers. It's just far less common. So what should you watch for? A persistent cough. That's the big one, especially the classic smoker's cough. When that cough starts bringing up blood-streaked mucus, it means the tumor has grown large enough to invade a bronchus, where tissue is breaking down and bleeding into your airway. Chest pain? That shows up later, when the mass is pressing on surrounding nerves. Shortness of breath? That happens when you've lost so much functional lung tissue that your body is starving for oxygen. Or when fluid starts pooling in your chest because cancer has spread. None of these are early signs. These are signs the disease has already dug in deep. Here's something fascinating. During the COVID pandemic, when CT scans became routine for millions of people, we saw a huge spike in early lung cancer diagnoses. Not because more people suddenly had cancer, but because we were finally looking. Those scans caught small, silent tumors that would have grown unnoticed for months or years. Even a pandemic has a silver lining. Stomach cancer is another silent killer. It's more common in men, and like lung cancer, it loves bad habits: smoking, heavy drinking, and diets packed with spicy or raw foods that chronically irritate the stomach lining. In Asian countries, where people drink boiling hot tea and eat extreme spices, stomach cancer rates are way higher than in Europe or the US. Japan actually screens their entire population with endoscopies, which is why they catch it early and have far fewer people dying from advanced disease. There's also a bacterial villain, Helicobacter pylori. Most people carry it. It burrows into your stomach lining, triggers chronic inflammation, and over time that inflammation causes mutations. Chronic inflammation is a highway to cancer in almost every organ. And yes, genetics matter. If stomach cancer runs in your family, your risk shoots up 2 to 3 times higher. What are the symptoms? Heartburn, nausea, vomiting. In severe cases, vomiting blood. And one of the hallmark red flags, rapid, unexplained weight loss. If someone drops 10 or 15 pounds in a few weeks without trying, that's your body screaming that something is wrong. It means you're not absorbing nutrients properly, and that could be because a tumor is taking up space in your stomach. But again, by the time you're losing weight, that tumor is already several centimeters across. It's pressing on nerves, disrupting digestion. That's not early detection. That's late-stage disease announcing itself. Colon cancer, or colorectal cancer if we're being technical, usually strikes people over 55. And here's the frustrating part. There are no early symptoms. What you might notice later: lower belly pain, pain when you go to the bathroom, blood in your stool. Here's the detail most people miss. If the blood is bright red, it's usually hemorrhoids. Annoying, but not cancer. If your stool is black and tarry, that's a whole different story. That means bleeding high up in the colon, and by the time the blood moves through your system, it's been broken down and oxidized. That black color is a warning you can't ignore. Risk factors: smoking, alcohol, and the big one, red meat. The data is crystal clear. Heavy consumption of red meat, especially processed stuff like deli meats and shelf-stable sausages, significantly raises your colorectal cancer risk. Ironically, those fake soy sausages? Safer. There is one decent early screening tool: the fecal occult blood test. It's not perfect, but it can pick up microscopic traces of blood in your stool before you'd ever see it yourself. Now let me talk to the men, or more likely, to the women who care about the men in their lives, since most of you watching are women. Prostate cancer usually develops in men over 60. And here's some good news: it's one of the less aggressive cancers. Even when malignant, prostate cancer tends to grow slowly and responds well to treatment. And unlike most cancers, there's a blood test that can catch it early: PSA, or prostate-specific antigen. If that number climbs, it's time to investigate. The tricky part? Early prostate cancer symptoms look exactly like benign prostatic hyperplasia, which is just a fancy way of saying an enlarged prostate. Frequent urination, discomfort when you pee or during sex. The symptoms overlap, but if you see blood in your urine, don't wait. That could be prostate cancer, or bladder cancer, which is also heavily tied to smoking. Notice the pattern? Smoking keeps showing up as a villain across lung, bladder, colon, stomach, and more. Let's talk about blood cancers, leukemias and lymphomas. People call it cancer of the blood, though technically it's cancer of the blood-forming tissues. The telltale symptom? Pale skin. That's because malignant cells crowd out your normal blood production, your red blood cell count drops, and you become anemic. Another major sign: swollen lymph. Nodes, and not just in one spot. You'll see them in your neck, armpits, groin, all over your body. The good news? Blood cancers can often be caught with a routine blood test. If your white blood cell count is off the charts, especially certain types of lymphocytes, that's a strong signal something's wrong. For women, There are the gynecologic cancers: cervical, ovarian, uterine. One of the biggest risk factors is human papillomavirus, HPV. If you test positive for high-risk strains, your cancer risk jumps dramatically. Early symptoms might include bleeding after sex, pelvic pain, or a sensation of fullness low in your belly. Later symptoms include unexplained weight loss, crushing fatigue, low hemoglobin, and abdominal swelling, which happens when fluid builds up after cancer spreads to the lining of your abdomen. There's a tumor marker that helps with early detection, CA125. Elevated levels can point to ovarian or other gynecologic cancers, though it's not foolproof. Now let's talk about brain cancer, one of the rarest but one of the most well-known because of the celebrities who've died from it. Glioblastoma and related tumors have taken public figures we loved, and their stories stick with us. Here's what most people don't know. Primary brain tumors, tumors that actually start in the brain, are extremely rare. Most of the time, cancer in the brain is metastatic. It began somewhere else: lung, breast, colon, prostate, and traveled through the bloodstream to the brain. But when primary brain cancer does happen, it's one of the few cancers that causes symptoms early because there's no wiggle room in your skull. Even a small tumor, just a couple of centimeters, can shift brain structures and create problems. What kind of problems? That depends entirely on location. Tumor in the occipital lobe, vision problems, floaters, double vision, blind spots, cerebellum. You lose balance and coordination. Frontal lobe, your personality shifts. Temporal lobe, memory fades. These symptoms can show up while the tumor is still relatively small, which makes brain cancer one of the rare malignancies where early detection based on symptoms is actually possible. So let's bring this full circle. If you've stuck with me this far, you now understand something most people never grasp. You cannot rely on symptoms to catch cancer early. By the time you feel something, the clock has already been ticking. Here's what you actually need to do. Women, annual ultrasounds and mammograms. No excuses, no exceptions. Current or former smokers, chest X-ray or low-dose CT scan once a year minimum. If you've got a heavy smoking history, what we call a high pack year index, consider screening every 6 months, everyone over 50, fecal occult blood test annually, and if there's any family history or worrying symptoms, get a colonoscopy. Men over 60, annual prostate ultrasound and PSA blood test. Women, annual pelvic exams and pelvic ultrasounds. And anyone with lots of moles or serious sun exposure history, see a dermatologist every year for a full-body skin check with dermoscopy. If you've got any gut symptoms, pain, nausea, blood in your stool, weight dropping without explanation, see your doctor immediately and push for an endoscopy if needed. Stomach cancer is common, and ignoring the signs can be fatal. And now the lifestyle piece, which you've heard before, but I'm saying it again because it matters. Don't smoke. Limit alcohol. Stop tanning. Those 3 changes alone will slash your cancer risk more than anything else you can possibly do. I know carving out time for medical appointments feels impossible, but this isn't about being a hypochondriac or checking a box on some wellness checklist. This is about getting real, actionable information about your health while you still have the power to act on it. Don't wait for symptoms. By then, you're playing catch-up, and the game is already halfway over. Take care of yourself. I'm Dr. Sam Brown, and I'll see you next time.